Postoperative Hypospadias and Epispadias Care by Barbara Montagnino.
The success of hypospadias and epispadias repair is not only dependent on having the appropriate instrument, sutures, and surgical skill. The postoperative care is equally important in ensuring overall successful outcomes. Nursing has an essential role in the education of proper pain management, medication administration, nutrition, hygiene, dressing, and catheter care. In this video, we will discuss the postoperative care for both hypospadias and epispadias repair.
Hello, my name is Barbara Montagnino. I'm a registered nurse and clinical nurse specialist working with IVU Med.
Terminology.
Here are some helpful words for today's discussion. Meatus is the opening of the urethra. Glans, the head or tip of the penis. Chordee is the abnormal downward curvature of the penis. Scrotum is the skin sac hanging below the penis containing the testicles. Cryptorchidism, also called undescended testicles, is when the testicles are not in the scrotum. Inguinal hernia is a protrusion of small intestine through the patent processus vaginalis, or the channel through which the testis passes from the abdomen to the scrotum. Disorders of sexual differentiation or conditions where it is uncertain if the sex organs of the child are male or female. A bladder spasm is a sharp, intense pain felt in the bladder, penis, or rectum. It usually passes very quickly. Familial refers to when other relatives, in the case of hypospadias, father, brother, uncle of the child, have the same condition. A fistula is a small opening between the newly created urethra and the outside of the penis. It allows small amounts of urine to leak out of this new opening. A stricture is a narrowing or scarring of the new urethra.
Overview of Epispadias and Hypospadias.
Epispadias is a rare defect in which the urethra opens on the top or dorsum of the penis instead of the tip. The severity depends upon the location of the urethral opening. The repair is a surgical reconstruction of the urethra. Since the repair of epispadias is very similar to that done for hypospadias, and the post-operative nursing care is also similar to the care of the child undergoing hypospadias surgery, it is included in today's discussion. What is hypospadias? Hypospadias is a birth defect in which the meatus does not attain its normal position at the end of the penis. The severity of hypospadias depends on the location of the opening. This illustration shows a range from mild to severe depending on where the opening is located. Chordee is the abnormal curvature of the penis, as shown in this picture. Other conditions also associated with hypospadias might include cryptorchidism, more commonly known as undescended testicles, inguinal hernia, as well as disorders of sexual differentiation. Hypospadias is a very common birth defect. It occurs in about 1 in 250 live male births in the United States and has steadily been increasing over the past several decades. What are the causes of hypospadias? It's not known what the cause of hypospadias is at this time, but it's thought to be multifactorial. It does occur in families, making it a familial problem, and it also has been associated with a lower amount of male hormone androgen, so it does have a hormonal component. How is it treated? Surgery is the only treatment for hypospadias. The goal of surgery is to bring the meatus to the tip of the penis, to the glans. There are many different types of procedures used to repair hypospadias. If chordee is present, the penis is also straightened either before the hypospadias repair is done in cases of severe hypospadias as a two-stage procedure, or sometimes in the same procedure with the hypospadias repair. If the hypospadias is not very severe, it can be done in one setting. The time spent in repair is generally from 1.5 to 3 hours, again depending on the severity of the hypospadias and if chordee is present or not. The surgical goals of hypospadias are to create a straight penis, to get the opening, the meatus, at the tip of the penis, to allow the boy to urinate in a standing position, as well as to get a good cosmetic result.
Medications.
Here are some medications that will be used in children who are undergoing hypospadias or epispadias repair. Antibiotics are given to prevent infection of the surgical site. Bactrim is one of the most common medications given, and it can have some side effects that the nurse should be aware of, including nausea, vomiting, and a rash. Cipro is another antibiotic that is used in urological procedures and can also have the side effect of nausea. Patients with G6PD deficiency do not receive Bactrim or Cipro because it may cause hemolysis. Ditropan is an antispasmodic that relaxes the bladder, lowers bladder pressure, and helps to decrease bladder spasms, which are very common in children who have a catheter in place. This medication can cause facial flushing, which is very worrisome to both nurse and parent at times, and a dry mouth, which is uncomfortable for the child. So these are things that you can prepare the family for. Tylenol is the one that is most commonly used because the pain is generally not severe after these surgeries. Motrin is another pain reliever that is often given. And for those children undergoing more extensive repairs, Lortab may be used. It's important to remember that this medication can cause extensive drowsiness, dizziness, and the child should not be left unattended after receiving Lortab.
Nursing postoperative care.
The nurse's role in preventing pain is key. The whole success of the surgical procedure really depends upon the postoperative care that the child receives. Crying and straining from pain or from bladder spasms can cause bleeding at the surgery site, and this may cause a hematoma, which compromises the repair. Children with catheters may complain of spasms, pain felt in the bladder, penis, or rectum. Give medication as ordered and make sure the catheter is not kinked or blocked and is draining urine. Alleviate constipation to help decrease pain from spasms. Instruct the family to notify you if the child is experiencing pain or bladder spasms. Nursing care after surgery involves taking care of the dressing placed at the end of the procedure. All of the sutures are absorbable except for the suture holding the catheter in place, and this is clipped just prior to removing the catheter. You can expect a small amount of blood under the clear plastic dressing. You should avoid heavy bed linens on the operative site. This can be accomplished either by a bed cradle or improvised with a tent, as you see in this slide. The dressing stays in place for 1 to 12 days depending on the surgical procedure done, with the more extensive and complicated surgical repairs requiring the surgical dressing to stay in place for a longer period of time. The bandage is removed 3 to 5 days after a simple repair and up to 10 to 14 days after a more complicated repair, or if grafts or flaps are used. If the bandage falls off, antibiotic ointment is applied to prevent the diaper or clothing from sticking to the penis. If the dressing becomes soiled with stool, try to gently clean the area with warm water and report this to the physician. Securely tape the catheter, allowing enough slack to avoid putting pressure on the penile opening. Apply a small amount of antibiotic ointment to the tip of the penis to prevent crusting around the catheter. No tub baths are generally given because those sutures that are used to close the wound are absorbable, so you do not want them to get wet. So sponge baths for the first several days are given. If a tub bath is ordered, avoid soap and lengthy soaking, 10 minutes only. The catheter should be retaped if it gets wet, and it's key to notify the doctor if the catheter comes out, and do not try to put the catheter back in. Urine draining from the catheter may be clear or pink tinged with an occasional piece of mucus or clot. Drinking lots of fluids keeps the urine draining. Check the catheter often for kinking or blockage due to mucus or clots. After surgery, the catheter is connected to a drainage bag. The bag should not be allowed to drag on the floor. It should also be emptied frequently before it's 2/3 full. And if the child is having to wear a catheter long term, the bag can be washed in warm soapy water at regular intervals and also rinsed with a solution of water and vinegar to eliminate odor. One of the key functions of the nurse is to address the diet of the child post-operatively. It's very important for them to be well hydrated to keep urine flowing through the catheter to keep it from becoming occluded. Constipation is sometimes an issue in children following surgery because the medications that we use to treat bladder spasms, as well as those to alleviate pain, may cause constipation. Encouraging fiber in fruit and cereal in the diet will help to eliminate constipation. After surgical reconstruction of the urethra, quiet activity is allowed. The child should not use any type of straddle toy or engage in any sort of activities which might result to a blow to the surgical area. Charting is important after hypospadias and epispadias surgery. The appearance of the dressing should be documented, the position of the catheter, including if it is taped properly to the abdomen, and also patency of the catheter, is urine flowing freely or if it has needed irrigation. The appearance of the urine is noted. Initially, there may be some slight blood-tinged urine in the catheter, but this should resolve after a couple of days and it should be clear. The amount of urine output is recorded. Any signs or symptoms of bladder spasms, if urine is passed around the catheter, this generally means that the child is having a bladder spasm. They may also complain of abdominal cramping and may also report or complain of pain in the rectum. Medications that are given for pain, antibiotics, and bladder spasms are also recorded. Here's a sample nurse's note for a patient post-operatively. This is important for the physician for follow-up and for the next nurse coming on so that they are aware of what's been happening with the child during the previous shift. After surgery, call the physician if the patient vomits more than 3 times and can't keep liquids down, if there's continuous bleeding underneath the dressing. If the catheter is not draining urine and is occluded, it may need to be irrigated. If stool gets on the dressing and you're unable to wash it off, if the catheter falls out, the physician needs to be notified right away. If there's a large amount of swelling or discoloration on the penis or the scrotum and it looks like a hematoma is forming, the physician should be notified. And if the child runs a fever over 102 Fahrenheit or 39 degrees centigrade, the physician should be notified. Any severe pain not relieved by medication is also cause for concern. It's very important to inform parents as to what to expect when they go home with their child after hypospadias or epispadias repair. They can expect that the penis will be swollen that the scrotal skin will be discolored and bruised for several days, maybe even weeks. This is normal and will gradually improve over the next several weeks. The only stitch that needs to be removed is the one holding the catheter in place. The other stitches will dissolve as the incision heals. Small fluid-filled sacs may appear on the head of the penis. These go away without treatment and are no cause for concern. It's important to let families know this may happen. After the bandage is removed, the penis may swell slightly. This is normal.
Follow-up care and complications.
Follow-up care depends on the degree of the defect and the surgical procedure that was done. Of course, children having a more extensive repair will have the dressing in place and the catheter in place for longer periods of time. So the more severe defects will have catheters in and dressings in place for a longer time. If the child does not have a dressing, apply antibiotic ointment frequently to the penis to keep the clothing from adhering to the surgical site. After the dressing is removed on those children who do have a dressing in place, it is also important to keep antibiotic ointment on the surgical area. And then antispasmodics are discontinued once the catheter is removed. Complications are grouped into those that occur early on and those that occur later. Wound infection may lead to fistula formation, and this usually occurs within the first 48 hours. A hematoma, bleeding at the area, most often will resolve if it's very small. If it is a larger collection of blood, surgical drainage may be necessary to prevent infection and to allow the wound to heal and to salvage the repair. If a fistula occurs, this is usually early on, and you can see urine coming from another opening in the surgical line, and the repair of a fistula is delayed for at least 6 months after the initial surgery. Meatal stenosis is usually noted when the parent or child reports that the urinary stream is coming out in a fine, thin line. This can sometimes be taken care of with just dilatation with a lubricated catheter. May require some minor procedure under anesthesia later on, but can many times be taken care of in the office setting. The diverticulum complication is when the urethra bulges once the child has voided, and there's a collection of urine in this diverticulum after the child has urinated. Surgical repair is needed to repair the diverticulum. A stricture occurs when there is scar tissue formation along the surgical repair, and is noted when there's a fine stream of urine when the urine is being passed, and also the child is straining to urinate. They may be unable to empty their bladder, which results in residual urine staying in the bladder and the child developing urinary tract infections. Surgical repair is needed to correct this problem. Residual chordee may occur, and if this is the case, a second surgical procedure is needed for that.
With proper postoperative care, pain and potential complications such as fistula and gland dehiscence could be significantly reduced. Collaboration between the surgeon, the nurses, and the parents will ensure that the child will have a most optimal outcome.
That concludes our video on postoperative hypospadias and epispadias care. Please help us improve the content by providing us with some feedback. What did or didn't you like about this video? Was the content too simple, just right, or too difficult? Was the length too short, just right, or too long? Any additional comments? You can either click the Start a New Discussion button and type in feedback, or send us an email at openpediatrics@childrens.harvard.edu. Note, feedback is not required to complete this activity in the guided learning pathway.